A Lake Geneva woman walked into the doctor's office with a common cold. However, she walked out with a $1,200 bill. Consumer investigator Kristen Byrne explains why she feels that the healthcare system failed her.
We've all had those lingering coughs in winter. Shelly Principe was sick with hers in October of 2018 and finally went to see her doctor.
Well, it was a pretty routine appointment, but the doctor said it was probably something viral, but he wanted to make sure it was not, actually bacterial. So he said, we'll just do a quick test.
So a nurse did a nasal swab on Shelly. It was for what's called a respiratory pathogen panel. It tests for 21 viruses, including H1N1, influenza A, B, various coronavirus strains. The list goes on and on.
Did you know you were being tested for all of those viruses?
I didn't. I mean, they did not explain to me that they were going to, do this test that would be every potential influenza bug or other things that I never even heard of, frankly.
Then she got the bill, a more than $1,200 bill. And then this.
The results came back that it was nothing serious. They said it was pretty much a common cold.
She called her medical provider and insurance company and tried to fight her bill. She thought it was under review, but she was sent to collections.
What are you frustrated about?
Well, I think I'm frustrated, first of all, at the fact that there was no communication about the fact that this test was so expensive.
Looking back, did you think maybe I should have asked what would be the cost of this?
Looking back, yes.
But she says that shouldn't have to be how it is.
Well, I think doctors should have a sense of what tests cost that they are directing be done to their patients.
The problem is that even if you ask the doctor what it might cost, he's probably not going to know.
That's not required by law. Hartford attorney Ryan Woody explains. He handles medical billing disputes for companies' employees around the country, including Wisconsin. The medical billing system in our state, he says, isn't consumer friendly.
When you walk in and sign that admission form, you're signing a blank check.
That doesn't mean as a patient you are powerless.
What rights do they have? What can they do?
Patients really need to understand their health insurance coverage.
He knows it's not always possible, but he says if you can, before walking into your doctor's office, call your insurer and make sure the procedure or test you're getting done is in network. And on the Wisconsin Price Point website, you can view the average cost of common procedures in the state and price compare with other Wisconsin hospitals.
I appreciate the fact that it was a test to make sure it was nothing more serious, but it just seemed a little extreme.
Shelly Principe is trying to see if the collections agency will negotiate pay with her, but she feels there's a lack of transparency in medical billing that has to be fixed.
I don't know of any other service provider that has no idea what something might cost.
Shelly wrote to lawmakers and sent a letter to the White House. She also filed a complaint with the state. And I filed an open records request and learned that her medical provider responded to Shelly's complaint with the state's Consumer Protection Agency, saying that staff reviewed her dispute many times, but in the end decided her bill was accurate. If you want me to look into your medical billing concern, contact me at kristen.byrne@tmj4.com. I'm consumer investigator Kristen Byrne.
And we put together steps you should take before you walk into the doctor's office that may give you a better idea of just how much your visit will cost. You can see that right now on tmj4.com. Simply click on this story.